4. Precepting using microskills. Because time is at a premium in most clinical settings, the following quick technique, 1 to 5 minutes maximum, might be helpful. Precepting using microskills was developed to be used in your office or in the hallway. Its primary purpose is to assess and improve the senior resident's decision-making skills. The 6 steps are: 1. Get a commitment. 2. Probe for supporting evidence. 3. Teach general rules. 4. Reinforce what was done well. 5. Correct mistakes. 6. Encourage reflection and integration. Video, 1-minute preceptor in action. Get a commitment. After the learner has examined the patient, ask the learner for their diagnosis/treatment/issues before offering your opinion or ideas about how he or she should have proceeded. This is the first step in diagnosing what the student's learning needs might be. The issue. How to ask for a commitment. Differential diagnosis: what do you think is going on or is most likely? Diagnostic strategy: what investigations should be ordered? Selection of therapy: what is your first choice of medication/treatment? Prognosis: what do you think is probably going to happen? Management issue: why do you think this patient is non-compliant? What would you like to achieve this visit? Probe for supporting evidence. This step gives you the opportunity to see what evidence the learner used to guide their decision. Your teaching goal continues to be understanding the student's thinking process in a non-judgmental way. X. What led you to make this decision? Briefly teach general rules. If your probing of the learner reveals the learner needs/wants more knowledge about a particular topic, provide general rules, concepts, metaphors or considerations. Don't provide the learner with a direct solution to the problem. Don't provide lengthy explanations. X. Patients with hypothyroidism often exhibit cold intolerance, weight gain and constipation. Reinforce what was done well. Tell the learner exactly what they did correctly and the effect it had on the patient and/or your clinic. This reinforces the correct knowledge or behavior. X. You're probing for more information about the patient's support system. Highlighted several points where the patient is going to have problems complying with a standard care plan. Having this knowledge up front allowed you to suggest alternatives that could be very helpful to this patient. Page 56. Correct mistakes. In a non-life-threatening situation, wait until you have some time to discuss the mistake in private. Avoid responding in a judgmental way and find out the following. Is the learner aware of the mistake and what to do? Then you need to reinforce the correction. Is the learner aware of the mistake and unsure what to do? Then this is a teachable moment. Is the learner unaware of the error? Then you need to highlight the consequences of the error. Is the learner refusing to admit the error? You may want to discuss the general consequences of medical error. If this becomes a pattern with this particular learner, you may want to discuss the issue with the medical school coordinator. X. The results of the urinalysis will confirm your diagnosis of cystitis. What questions could you have asked to check for other causes? Encourage reflection and integration. Students become consciously competent by reflecting on the consequences of their actions and making decisions about what they might do next time. You can help them with that process by specifying the location of further research that might be interesting. Using debriefing questions such as: who was your most interesting patient today? And was there anything that you didn't expect to experience? Asking the learner to keep a reflection log that will be used as part of their final evaluation. X. How could you learn more about that topic? A 5-step microskills model for clinical teaching, 1992, Neber, J.O. et al. Journal of the American Board of Family Practice 5-419-424. The Microskills Teaching Model, Kansas University Medical College.